Cervical cancer is one of the most common cancers in women and among the greatest threats to their health. The most valuable weapon in the fight against it is time. The earlier cancer can be detected, the better. For this reason, the Pap test, which can detect pre-malignant cancer, has become a routine part of healthcare for most adult women. In some cases, abnormal findings in a Pap test will require an HPV test as well. Lakecore Medical Center offers the very latest, most technologically sophisticated testing procedures available for both Pap and HPV tests. In a moment, I'll tell you more about how these tests work at Lakecore. The introduction and widespread use of the Pap test has led to an enormous decrease in the prevalence of one of the most dangerous medical conditions that women can face, cervical cancer. Almost all adult women should undergo routine Pap tests to screen for cancer, usually every 3 to 5 years. But not all Pap tests are equally effective. At Lakecore Medical Center, we offer the ThinPrep Pap test, the most trusted test available. More accurate than a conventional Pap smear, it can be combined with the ThinPrep imaging system to detect disease even more accurately. With the ThinPrep imaging system, your test is actually screened twice, first by a high-tech imaging machine and then by a professional. If any abnormalities are found, the results will be reviewed by a pathologist, specially trained to detect cancer. In order to prepare for a ThinPrep test, it is best to schedule your appointment when you do not have your period. The best time is 10 to 14 days following the day of your last period. For best results, avoid any vaginal medication or product and avoid intercourse for 2 days before your exam. The test involves a doctor taking cells from the cervix for analysis. The doctor will insert a speculum and then collect a small sample of cells from the outer opening of the cervix. The cells are sent to a laboratory to be checked for abnormalities. Lakecore Medical Center will make sure that you receive results as quickly as possible. For women over 30 whose Pap test results show certain specific abnormalities, an HPV test is recommended. HPV, or human papillomavirus, is a virus often transmitted sexually that can lead to or be associated with certain kinds of cancer. HPV is very common, and having it doesn't at all mean that you have or will have cancer. But in attempting to detect cancer in its earliest stages, it can help doctors to know if a patient has certain kinds of HPV. The test is conducted much like a Pap test, but the cells that are being examined are tested for HPV DNA using a sophisticated technology. You do not need to order an HPV test just because your Pap test comes back inconclusive. Your doctor will recommend it to you in cases where it is called for. Whether you need a ThinPrep Pap test, an HPV test, or tests for gonorrhea or other STDs, you can be assured that you'll get the appointment you need when you need it. You can also have a blood glucose test or be inoculated with Gardasil or Cervarix, both HPV vaccines. At all times, you'll be in the hands of exceptionally well-trained professionals who are using the very latest and best equipment that exists. Lakecore combines the very best in medical practice with all the comfort and luxury you might expect from a high-end spa. For your tests, call and arrange an appointment today.